Hi, thanks for joining us. My name's Dave. I'm one of the therapists here at the Huruska Clinic, and there's a couple of parts to this video. In a moment, you're going to get to watch Lori talk a little bit about pelvic floor dysfunction, and then she's going to take you through an exercise where she'll be on her right side, and she's going to help you engage the left inner thigh muscle. And she's going to talk a lot about why we're doing that and what the value is for you. After her portion of the video, then you're going to come back to me, and we're going to do a seated version of that exercise as well, because sometimes we realize there's times when you're not going to be feeling capable of getting down on the floor to do the exercise. So here in a second, like I said, Lori will take you through an exercise and then you'll come back and see me.
Hey everybody, thanks for tuning in. Today we're going to talk a little bit about the Kegel, and if you're like many of my patients that have had some pelvic floor dysfunction, male or female, sometimes males might, after they urinate, they might dribble afterwards. I've had some men that have also had, other pelvic floor dysfunction. Women, we're just a little bit more, we'll talk about it. Men won't talk about it as much. But sometimes we do need to work on strengthening that pelvic floor. At our clinic, we will take an outside-in approach. It's a really big deal to make sure that your pelvis is in the right biomechanical position first, and then you have the strength and the stability with muscles that attach to your pelvis in order for the pelvic floor to be able to function and work correctly. The vast majority of us have, remember, you have two. You have a left side and you have a right side with your pelvic floor. And all of us are stronger doing a Kegel on our right side. So if I don't know what position my pelvis is in, and I get told, by a well-intentioned therapist or medical doctor to Kegel, without taking a respect to your pelvis position, the vast majority of the time you are going to be Kegling with your right side of your pelvic floor versus your left. So I'd like to make that case in point to you. If you guys sit on a chair, what I want you to do is I want you to pull your right knee forward or your right knee back. That's going to help pull your right hip back and your left hip forward. Once you get here, I want you to press your right knee into your left hand, and you should feel your right upper groin muscle engage. Once you feel that right inner thigh engage, I want you to Kegel or pretend like you're trying to stop the flow of urine if you were going to the restroom. And then go ahead and relax. Keep that contraction in mind. And now I want you to do opposite. I now want you to roll your right knee forward and your left knee back. And when you pull your right knee back, I want you to press your left knee into your right hand. If you do not feel your left inner thigh, I do not want you to try to proceed to do a Kegel, because now you're not in the right position and I don't want to create more pelvic floor problems for you. But if you can pull your left knee back and pull your left knee in, and you can feel your left inner thigh engage, I want you to Kegel on the left side. And for the vast majority of you, it's going to be easier to get that Kegel contraction with your right knee behind your left versus the left knee back behind the right. So I'm going to show you a common thing that we work on in the clinic, because your left inner thigh helps to lift your pelvic floor on the left side. It's kind of like an unconscious Kegel. And so instead of having people Kegel, we help people find their left inner thigh muscle, because that helps to lift the pelvic floor on the left side, but we're going to respect an outside-in approach in order to do that. So a common thing that we do in the clinic is this is called a right sideline respiratory adductor pullback from the Postural Restoration Institute. So you would lay on your right side. You have a towel roll between your feet, and that towel roll needs to be big enough that your left knee is below your ankle and your left knee is below your hip. And then we take a folded towel and we place it between your knees so you have padding. You're going to press both of your feet gently in the wall, but I especially want your bottom right foot. You're going to take a breath of air in through your nose, and your breathing diaphragm and your pelvic floor work together. So the breathing mechanics are a really big deal, but I don't have time to scope of this video to go through the respiratory piece of this. But you're going to inhale through your nose. You're going to pull your left pelvis back or your left knee behind your right. And then I want you to exhale through your mouth as you squeeze your left knee down into the towel. You're going to hold it for 3 counts. Then inhale, pull back a little bit further with your left knee behind your right. My left hip is going to go back. I'm going to exhale, squeeze down, and you should feel your left inner thigh engage. It should not cramp. You should not feel your hip flexor. If you can't do this, we don't want to hurt you. You probably maybe want to come in and see us. But if you can't do this, you're going to continue that sequence of inhaling through your nose and pulling back, and exhaling, squeezing as you pull down. And you're going to do that 3 to 5 times. Just pull back a little bit at a time. You'll line your knees back up together. That'll equal 1 rep. And you're going to do that 4 to 5 reps. And then for fun, I want you to come over and look on your Kegel again. So you can go over, sit in your chair, pull your left knee back behind your right, pull your left knee in. Oh, I feel my left inner thigh better. And Kegel, and you might find that you have a stronger Kegel contraction. Because this external muscle on your outside in approach helps to put your pelvic floor in a better position to work for you. And that's the importance of doing an outside in approach. I hope that helped. Have a great day.
Hopefully you enjoyed the video that Lori just took you through doing an exercise laying on her right side. As you noticed early in the video, she was sitting in a chair much like this and described a little bit about feeling the inner thigh muscle on the right compared to feeling the inner thigh muscle on the left. And what she did there initially was sort of the video or the exercise that I'm going to do now. But we're going to take a ball and we're going to put it between the knees. And I like to also put ourselves in a position where the feet are elevated a little bit, gets our knees up so we're at hip level. That's going to put us in a better position. I also want to feel the bones, our sit bones is what we tend to call them, under me on a chair. A nice firm surface is going to work well for you. But we're going to take that ball and we're going to place it between the knees. And sort of like she did early in the video, we're going to shift. And hopefully with the ball movement, you can see that little bit of a roll. And we're going to work on the left one coming back. Sometimes when we do that, it's natural for people to almost want to sit over here on the right side, but that's not what we're after. I really want you to be able to shift just like this. Right knee's a little forward, left knee's a little bit back. I'm still feeling both sides. I'm a little bit rounded through the back. I don't want to be up here, just round a little bit. And then I'm going to take that left knee and gently press that ball. And I'm going to hold that while I breathe in through my nose and blow out through my mouth about 5 times. In the process of doing that, I can feel my left inner thigh muscle working. Occasionally, patients will tell us, well, I think I'm doing it right, but I don't really feel that muscle engage. It's okay to take your fingers and just kind of place it on the muscle as you shift back and give a little squeeze. Most of the time, then you can sense that muscle engage. And that is just another alternative to doing the exercise that Lori took you through if you don't feel like you can get down on the floor at this time.